Beste kijkers, welkom in een nieuwe info-aflevering van het Mungra Medisch Centrum, aflevering 51. Zoals u weet is het oog een onmisbaar orgaan van ons lichaam. Haast bij elke handeling die wij plegen zijn onze ogen actief. Het zit heel knap in elkaar, maar is tegelijk erg kwetsbaar. Wilt u meer weten over het oog, blijft u afgestemd. We hebben vandaag in ons midden dokter Walid Dandan, onze huidige oogspecialist in het MMC. Bent u benieuwd te weten wie dokter Dandan precies is en wat hij ons allemaal te vertellen heeft? Komt u mee. Dr. Dandan, welcome in our program. The viewers want to know who Dr. Dandan really is. Could you please tell us about yourself?
Sure. Thank you for having me. My name is Walid Dandan. I'm an ophthalmologist from Lebanon. I started my medical education in California, United States, and continued in Lebanon, my training in ophthalmology, as well in Belgium, where I did part of it there. Afterwards, I started working in Lebanon for the past few years, until recently I've come to Nikeri to help in the ophthalmology department here.
Doctor, our eye is a very important part of our body. How does it really work?
Well, the eye is an adaptive optical system where the cornea and the lens help focus the light onto the retina, which is the posterior part of the eye. And the retina, in turn, transmits an electrical impulse to the brain so that we perceive the image as we do in real life.
Doctor, you have been working in our hospital for a few weeks. Could you tell us what are the most common complaints and how are they treated?
I've noticed several complaints. The most common ones are the cataract. The cataract is the lens changes that occur with age. Sometimes they can occur due to different reasons, but the most common reason is from aging, and it is a normal physiological procedure. It is treated ultimately by surgery, and nowadays surgery is done through a very small incision where we perform something called phacoemulsification, where we break down the cataract through ultrasound waves, we aspirate it, and then we implant an artificial lens inside of the eye so that the person can see as he used to before the cataract changes. The next complaint I've been seeing a lot is diabetic retinopathy. Retinopathy is a consequence of people who have diabetes that is uncontrolled. Therefore, it is very important for them to control their diabetes, keep low blood sugar, a normal blood sugar level, in order to avoid any retinopathies, where the patient will have a decreased vision because of the retinopathy. Another complaint I've been seeing a lot is pterygiums. Pterygium is a conjunctival overgrowth that starts to cover the cornea, and eventually it can affect the vision. In addition, it can cause a whitish appearance on the person's cornea, which some people dislike. The way to treat this is through surgery. We excise it and we put a graft in its place so that we avoid recurrence. This is very common here due to the hot weather, due to the exposure to the sun, to the wind, and to dust. Another complaint that is very common is also glaucoma. Glaucoma is when there's a high intraocular pressure in the eye, which can lead to damage to the optic nerve and eventually cause a decreased visual field. This is treated primarily through eye drops, and if the eye drops are not enough, sometimes we resort to surgery to decrease the intraocular pressure and try to preserve the optic nerve head as much as possible.
Doctor, why is an eye specialist so important in a hospital?
The eye specialist is important in the hospital because we advise every healthy patient to have a checkup once a year at least, because some of the diseases have no symptoms that are visible to the patient, or the patient cannot feel anything different. However, there are signs that the doctor can see ahead of time and therefore treat the patient as soon as possible. In addition, there are emergencies that the doctor should be available to treat as soon as possible. Some of these emergencies are, for example, infection of the eye. Sometimes there are severe infections of the eye in the cornea, what we call keratitis, and they need to be identified as soon as possible so that the doctor can prescribe antibiotics and treat the patient in order to prevent any damaging scars that can last and affect the vision. That's one of the reasons. Another reason is sometimes there are accidents that happen either motor vehicle accidents or accidents at work, where there's foreign objects that come into the eye, and they need to be removed as soon as possible as well before they cause any lasting damages. And this is where the doctor also helps in the management of the patient. Other emergencies are, for example, retinal detachment. Sometimes patients can have retinal detachments where the retina detaches, and this can cause permanent vision loss if it is not identified as soon as possible and referred to surgery if needed or managed properly.
Doctor, is our hospital well equipped?
The hospital already has equipment that helps us diagnose most of these problems, most of these complaints, and it has already ordered additional equipment in order to be a well-rounded clinic that can address most of the complaints and treat as much as possible of the etiologies that present to the hospital.
Dr. Dandan, you have worked in different hospitals. If you make a comparison between those hospitals and our hospital, what are your experiences in our hospital?
It's been a very pleasant experience. The hospital is a clean environment. The staff is very professional and very friendly, always available to help when someone has a question or is in need of help. And what is nice is that the different specialties work together to help the patients. So there's a very nice cooperation between the different departments. And all this is for the benefit of the patient.
Doctor, what can the community of Nikeri expect from you?
Well, with the arrival of the new equipment, the clinic will be prepared to screen for diabetic retinopathy, for glaucoma, for pterygium, for most of the general ophthalmological complaints. In addition, we will be able to treat most of them here in the hospital at Nikeri. So basically, any general complaint we will be able to address it at the hospital here.
Before we end this program, do you have a golden tip or a message for the community of Nikeri?
Yes. In medicine, prevention is the best kind of treatment. So it is very important for the patients to take care of themselves. What I mean by that is, for example, if they're going out in the sun, they should wear sunglasses. If they're working any kind of labor where there might be any dust or any particles flying, they should wear safety goggles. In addition, patients who have systemic diseases like diabetes, hypertension, thyroid disease, any systemic disease that can affect the retina as well or the eye, they should have good control of their diseases, which means they should regularly have checkups with their general practitioner and with the ophthalmologist, because it is always better to treat any disease as soon as possible than to let it increase in severity. That is basically my tip to the community.
Zo zijn wij aan het eind gekomen van dit informatieprogramma. De poliedagen van de oogspecialist zijn wekelijks op maandag, woensdag en vrijdag vanaf 8 uur. Voor registratie kunt u terecht bij het centraal meldpunt van het MMC. Wij bedanken Dr. Dandan voor zijn tijd en informatie. Ik ben Farisha Karimbaks en ik groet u vanuit het MMC. Tot de volgende keer!